Good afternoon, everybody. Welcome to the Offload Delay podcast, a very special show today. Very excited to have some extremely powerful, knowledgeable, feisty advocates here for the long-term care situation that's happening in our province here in Ontario and all over Canada, to be honest. In particular, we have Dr. Vivian Stamatopolous. Unbelievable that I'm privileged enough to have this powerhouse of a guest join us with the panel of ladies who support her and her work. Now, Dr. Viv, for anybody that doesn't know, is a professor at the Ontario Tech Social Science and Humanities School. She's also a long-term advocate and long-term care advocate and researcher. She's a co-founder of Canadians for Long-Term Care program. And let me tell you, I don't know how she managed to squeeze in this interview. I've been told she's in the several hundreds of interviews now with all the major media outlets across Canada, to be honest. When you turn on your TV, you're likely going to see Dr. Viv. Award-winning advocate. I'm going to bring her on right now. Super pleased to bring on Dr. Vivian Stamatopolous. Welcome, Dr. Viv. Thank you so much for joining.
Thank you.
Absolutely incredible, the work that you've been doing. I want to let everybody know that you were named in 2021 to Chatelain's prestigious Doris Anderson award-winning group. You were one of their, what was formerly known as Woman of the Year. And now it's the Doris Anderson Award, and you're a winner with them. They posted this lovely picture of you. They wrote a brilliant article. I encourage everybody that has not checked out the article to have a read and figure out exactly how amazing Dr. Viv has been in the last few years, particularly. But let's say, honestly, since COVID's hit, that's really triggered the fire in your belly. I know that you have a passion for long-term care. It's not a secret to anybody. Your passion was developed during your PhD work, correct, in sociology at York University. And then finally, you had a family member enter the long-term care institution facility, and then you were able to see inside the system close up. And that really triggered your passion. Can you just give us a brief intro to what's driving you most right now and what's going on in your world?
I think it's one of those things, right? People don't understand what's happening in long-term care, I think, until they live it. And that's why I really, bond with the families, because when you live through that system, it kind of changes you. And, I lived through it right towards the very, beginning of COVID. My grandmother had passed literally I think her funeral was the day the first case of COVID was in Toronto. So, thankfully, and there's no thankfully, I got spared the isolation, the confinement, because I would have lost my mind if I would have been locked out. But that's what started my advocacy, because when I realized how much I was, how involved my family was in long-term care, and just imagining being locked out was just the most upsetting. I just could not wrap my head around how this was happening. And, in the beginning of the pandemic, I think we were all just kind of like, okay, we don't know what's happening. We're all scared. You waited a couple weeks, then it turned into a month, then it turned into a couple months. And I think it was just like around 6 weeks in where I was like, no, this is not okay. What is happening here? Like, you can't just keep family out indefinitely. And that's when I started opening my mouth.
We're all super grateful to have someone of your status, someone of your background, some of your talent to be an advocate in this setting. I know my podcast, it's a first responder, but not only for first responder podcast. And a big part of my world as a medic over the last 20-ish years has been responding to long-term care facilities. And I'll be honest, the atrocities and the deficiencies and the horrible things that you're mentioning now that have been kind of highlighted through the COVID pandemic are things that I've struggled with my entire career. These are things that it was hard to have a voice as a lowly old paramedic walking in and out of a building, seeing the atrocities that were going on. It was frustrating to me. I didn't know who to tell. And when I did tell people, I don't think the message was being conveyed. So to have somebody like you to lead, and you're leading this revolution right now that's going on in long-term care. We're all grateful, and I'm super thankful that you would join me today on this podcast. I know also you've had hundreds of interviews. Your time is precious, and you've gathered a huge fan base. I can tell that because
it feels weird. weird hearing that.
It's true. I will tell you, my social media has never been so hot as soon as I put in your handle to say that anything to do with you, and it triggers instant attention from hundreds and hundreds of people. But it also has triggered attention from a smaller cohort of advocates that are out there that are less popular, less how do I want to say it, famous, because you're getting famous, if you like it or not. It's happening.
It's very weird.
And these ladies have been a voice behind you and with you for quite some time now. And actually, I had one of them, Leanne, was on my second podcast I ever had because I was so intrigued by her drive and what was driving her in her world with long-term care. And I'm going to bring these ladies on right now, if that's okay with you.
Yeah, please.
I'm going to slowly bring in, we have Leanne Schaefer, and now we also have MJ. And we have, last but I'm certainly not least, we have Maureen, and someone's dog. That's good. This is perfect. Yeah, this is amazing. That
Sorry.
no, this is our world. This is what we all.
For Maureen, that's
I just want to welcome everyone. Welcome, help me join me in welcoming Dr. Stamatopolous to the show.
Dr.
And
welcome, Dr. Viv.
I know you know these ladies through your work, and I know that they are absolutely thrilled. I made a promise to this group, especially through Leanne, that I would do everything I could do to get you on the show so they could talk to you, quote unquote, face to face, and have their comments that they had or their questions directly related to you, with exception of, we know this topic is massive. We know that this could be an entire series of podcasts daily for weeks on end, and we still wouldn't cover everything. So what I want to do is I want to kind of just have each of the ladies introduce themselves quickly and what drives them in this world and why they're doing what they do. And if they have a quick question for Dr. V, we'll do that. And then I'm going to move on to kind of some things that I want to bring up. So MJ, welcome. What brought you into the world of long-term care advocacy, MJ? What is it really that drove you?
Thanks for having me.
Absolutely welcome.
I think even just as a young person, I had a very soft spot for elderly people. So I volunteered in long-term care, and I worked with my aunt. She used to do hair in one of the homes, and my grandparents would be in there, and that kind of thing. So, or if you ever saw an elderly person fall, it would literally crush me, like any sort of lack of dignity kind of thing. So I think I just naturally always sort of felt for anyone who was in that age group or time of life kind of thing. Yeah. I also have family in Chartwell. I have family in Chartwell who, through COVID, it's been one of the worst homes in the area they live in. And I have parents who are actually in a retirement home, and they entered just about a year before COVID started. And although it's a retirement home, certainly through COVID, public health regulations go right across long-term care and retirement homes. And we're dealing with the same, lockouts and isolation and devastation and closing everything out for one staff outbreak, one staff member, all that kind of stuff. So we were starting to see, oh my gosh. And then I started to say, well, my parents had it pretty good because their retirement home is quite lovely, right? But there's still a profit-driven place, and we could still see shortage of staff,
right.
Lack of, getting the vaccines, people educating the staff workers to get their vaccines, all that. So I could still see, that it was happening. But I also know my parents need quite desperately actually to get into long-term care, because they unknowingly ended up having to live separately. Finances are a thing, right? Not everybody can manage that kind of thing. We weren't expecting 2 suites at a retirement, whatever, all these reasons. And I know they're like number 400, 500 on the wait list to get into where they have to go. And then I'm also equally concerned about them actually getting in now, because I start to see all the stories of what's there. I'm like, well, what are we sending them to? Like, we have to, but I don't want to. And
Dr. Viv, is that rare? Is that a rare thing you're hearing these days? These 400, 500 people wait list? Is this something that's normal?
Oh, it's normal, and it's just going to keep getting worse because of our aging population and the fact that people can't afford to age at home. The mechanisms to do so safely just aren't there. Home care is an even bigger mess than institutional care, right? Like, I mean, ask any family member that has entered either retirement housing or long-term care. They first tried to stay at home as long as possible. Nobody woke up and said, hey, I want to go into congregate care. Nobody ever said that. Everyone wants to age at home, but it gets to a point where you try and then you realize that system's completely shot to what, and there's never enough resources, and the reliability, unfortunately, of the workforce, at least in my experience, people would just not show up when they were supposed to, or they'd leave before they were supposed to, and they wouldn't do, we had things that were stolen from my grandparents' place. Like, I mean, and I hear this across the board. There is just so little oversight in home care. And then you think, really, you're told when it gets to a crisis point, you have to put your loved one in long-term care. It's never a choice. It's never a choice. Right. And then you feel terrible because nobody wants to make that decision. And what are your options? You either, and it's always goes to the women. The women either quit their job and suddenly, become independently wealthy and can stay home and provide full-time healthcare that they do not have expertise to provide. Right. In the home setting, it just with apparently lips and devices that cost thousands of dollars that you don't have and are supposed to somehow fund on your own. Like, it just isn't tenable. And then you think you're putting them in a place that is equipped with professionals who can help, and you're told that this is the bill of goods you're sold, and then you get in and I hear this across the board. Very few times do I hear, I have a great experience in long-term care. Yeah, it's gone great. I hear a few families say, I had a great time. My loved one was treated very well. And I love hearing those stories. But unfortunately, 90% of the stories that I hear are terrible ones. And there's a reason for that.
It's so common. You're absolutely right. And we have Leanne joining us at the bottom panel. Leanne was a guest, if anyone's watched my podcast before, with my second podcast to explain her story. Originally, sadly, Leanne was actually, her status has changed with us because she originally came on with zero family ties to long-term care. She was an outsider that was so unique, that had this passion for long-term care advocacy, but she didn't work in it. She didn't have family in it. She had zero direct ties. And she still had that passion, which was amazing. And that triggered me to bring her on as a guest. However, that's changed. In the few months since that podcast, Leanne, you now have a family member in the long-term care system. So you're even more vested than ever. Is that right, Leanne?
Yeah, she's not quite in the system yet, unfortunately. She is what they call completely volatile. So she is stuck at the hospital. She's been there for 4 months now. No long-term care will take her. And we're waiting for adult psych, but I have a best friend that's a nurse in adult psych, and I don't think that there's going to be beds anytime soon. So without going there, she's stuck at the hospital, and we've had 5 PSWs quit. And one of them happened to be one of the highest ranked in our region. They walked. Like, it's not her fault. This
podcast, Leanne, is titled Offload Delay. And exactly what you're saying, the backlog effect of a full long-term care facility is not able to get in the wait list. Now these people are in hospital. It's not necessarily where they need to be. We bring patients in. Yeah, depending on their stat, right? Yeah, we talked about.
She's tied down because she has COVID, which she contracted in the hospital.
Now let's just validate. There might have been something else we don't know. We talked about that. We don't know for sure. She's not just tied down because
she's wandering.
Yeah, I just didn't want to confuse anyone watching or listening. There was some other issues. It wasn't just a straight tie down from COVID. But the offload delays stem right from that. Like, we bring a patient in the door, we need a bed somewhere in the hospital, whether it's an emerge or wherever, and it's a trickle down effect. Yeah. And that story just is so common as well, Leanne. It's terrible, and it breaks my heart to hear that you're having to deal with that even more closely than you're already involved.
Yeah,
we have
now
Maureen.
I have my. Oh, sorry. Go ahead.
No, go ahead. We'll get back to you.
Yeah, go ahead.
Maureen, you definitely know Dr. Viv. You have met in the past, and you are one of the most driven panel members that I've yet to meet on dealing with the long-term care advocates. Thank you for that. Just give us a bit of your story, Maureen, as far as what has been leading you to have so much strength, so much passion.
Wow, you see a lot of things I don't, but thank you for the introduction. And honestly, thank you for inviting me here with these amazing, amazing women. And one of the things you need to know before we start is that we've all just experienced so much, and that without Twitter and without finding these women and hundreds of others, I honestly wouldn't have survived. So thank you to all my long-term care sisters and we've renamed ourselves Resistors, Resistors, which I love. So my name is Maureen McDermott, and my mom, Elsie, went into long-term care. Pretty much what Viv was saying, you know, had her at home, just assumed that we would be able to get the help and the care that we needed here because we were not putting her into long-term care. Found out very quickly that that's just not available in Ontario. She developed Alzheimer's and dementia. I grew up with a really large family, so we really never discussed mom's care because between all of us, we would somehow manage it. And life happened, and I lost all my siblings and was left alone with this diagnosis. So it was literally a crisis situation where she wasn't safe. I was no longer safe with her here at home. Her needs exceeded what I could do. So I really just needed the help with those needs that I could no longer meet. That's what I assumed long-term care was about. And I just assumed that the care portion was the paramount piece as well. And boy, oh boy, that was a big shock when we got in there. And I've said it before, and I'll say it again, putting my mother into long-term care that day was definitely worse than the day that she passed away. And I can't unsee what I've seen. And I'm a human, and I react and I care, and that's why I'm here, and that's why I'm not going anywhere until we finally get some national standards for long-term care. We get the profits out of long-term care, and finally get long-term care put on the Canada Health Act where it belongs.
Good. Excellent.
Yes.
Dr. Viv. Thank you, Maureen. It's amazing. Everybody has a story somehow related to long-term care. We're either headed there ourselves. It's almost inevitable for most of us, or we have people that are living longer and longer now. This isn't unexpected. The medicine has progressed, and the need for this is bigger. The population is bigger. It just, to me, how did we, Dr. Viv, this is a genuine question you may or may not know. How did we end up with this dichotomy in Ontario of a two-tiered system? It's you have a nonprofit long-term care, and most of the complaints I hear and that you've been advocating against, and the patients and for with those families, is the for-profit care. How did this evolve? How is it so different from the rest of healthcare in the province?
I mean, you know, it really boils down to us leaving it out of the Canada Health Act when, you know, we first developed it proper. And a large reason for that was because, you know, this was back in the day. Keep in mind, the 80s, you know, this was the time of stay-at-home moms and wives. You know, women didn't work the way they did now. And you know, advanced capitalism came, globalization fueled by women's labor. We went to work, and I'm glad we have that freedom to do that. But we lost that reserve army of unpaid reproductive laborers that did this very difficult work hidden in the household economy for free, and, you know, back-breaking difficult work that women have been doing forever up until, you know, this very significant generational shift where we entered the paid workforce, and women, you know, subsequently took on double, triple shifts trying to juggle paid work with unpaid work, be it childcare, senior care, and it's just untenable, and women just couldn't do it. And unfortunately, over the years, and this was part of what I studied in my PhD, you know, I love men, but their contributions in household labor have not increased.
I'm not going to
while
disagree at
women
all.
have entered paid labor. Like, we have the data on this. There's tons of Stats Canada data.
Sure.
I've included this in my dissertation. And so this is why the need for long-term care will continue to increase and has increased. And I think what a lot of people aren't thinking ahead, and I've tried to warn younger people about this now, we're particularly screwed, to say it nicely, because we have smaller households. Women aren't marrying as much and as often as they did before. Divorce is increasing. So to assume that we're going to have these large households and children to be able to take care of us is just not the case anymore. Things are changing. The demographic is changing, and young people are going to need long-term care probably more than any other generation of older adults. And they're not thinking about this, and they really should, because they are going to be harmed the most by this system if it is not changed. But unfortunately, a lot of people in this world only think 5 minutes ahead, an hour and ahead, next week, and they don't think long term. And that's a lot of, the psychosocial reframing of our minds with this world that we live in now. Short-termism, so to speak. People have written about this, and we're not thinking into our future, and it's a big problem. And then we've turned into an individualist society too, and that goes hand in hand with globalization, right? So this, we used to take care of each other. There used to be this collectivist mentality, and it's increasingly you're on your own, figure it out. And we're going to need long-term care more than ever before.
Absolutely.
And that's why I'm so scared for people right now. And I try to keep telling people, you really need to fight this, even if you're not living it right now, because you will. Mark my words, you are not above, unless you're independently wealthy, fine. You're never going to know long-term care. You think the people in our government are ever going to know long-term care? No, they're not going to know long-term care. Doug Ford had his mom at home the whole time. His mother-in-law's in long-term care, but his mother wasn't, right? Wealthy people historically never use long-term care. They either pay for round-the-clock care or they have really cushy retirement housing, which costs between $10,000 to $15,000, I hear from some people. So, the majority of people, right, because we're increasing the divide between the wealthy and the poor, we're all getting increasingly poor, are going to need long-term care. So they really need to think about this as something that is in their near future.
I didn't expect the F word to come into this so quick, Dr. V. The F word of Ford came in. We talked Ford, but that's going to be part of the theme on some of the things that we're talking about. One of my biggest things right now that I can't wrap my mind around is the rampant spread of these infectious diseases within these homes, which is obviously on the forefront right now with the largest pandemic we've ever witnessed in our generation and beyond. But to me, there's so many things broken, but how are these institutions, these facilities, these caregiving places, how are they not the most secure? Because of all places, the patients don't move. They're there. They're stuck there. They're housed there. They're institutionalized there. They're trying to live their lives there. We're controlling each and every person coming into those buildings. So much different than any other healthcare setting. How is it so lax that the COVID issue right now, especially, is on the forefront of these facilities?
I mean, this goes back. Unfortunately, we can thank, good old Mike Harris for having a really big role in privatizing out the case of long-term care in Ontario, right? So, 20 years ago, when we had to build a whole bunch of beds, he ended up giving like 70% of the bed contracts to the for-profit sector. And that's what kind of spearheaded us down this path. And then, when you look historically, it's no coincidence that 3 former PC premiers then went to sit on boards of very profitable for-profit long-term care chains. And you sit there and you wonder, wow, like, is it really that simple to sell your soul? Is it really, is that how it is? There's too many conflicts of interest. There's this whole industry is captured, in my opinion. I've said this. I said this to the long-term care commissioners. The interests of the lobby are what are being protected and advanced right now, not the interests of the residents and the workers. Because anybody that is paying attention sees that the workers are being screwed over just as much as the residents are being screwed over. Nobody wins in the long-term care sector, but really the CEOs who are making quite a lot of money alongside the shareholders.
Unbelievable. Now, that leads us to something that when we were in touch before going live, when we've been in touch the last few days, you had a particular bone that you were picking with a particular Rod Phillips. One of many bones that you've been picking with him. But you sent me this tweet here. That is, I think it's time to bring it in. Ladies, we're going to get some discussion on this for sure. Mm-hmm. You sent this out the other day that you're sitting there bewildered that Rod Phillips is trying to say that Andrew Horvath asking for N95s, which is basically the top level of care for any airborne disease that we know right now that's available to the public, in long-term care, for long-term care staff at all times is somehow irresponsible and putting them at risk to catch the virus. Are you joking? So are you telling me Rod Phillips is saying that N95s are going to worsen his mindset? Is this will worsen things?
I mean, I posted the videos. Everyone heard what he said. It was just, I was literally in shock just watching it going, what is happening here? Like, what we asked for in that press conference, so this is what happened in the morning. We had a press conference, myself and Andrea Horvath, and then we talked about what's happening and what are the main things that we want to see done, right? Things that I've been yelling about for a month now, over a month now. Things like prioritizing boosters for the workers in particular. Obviously, the residents have been prioritized, but it's still not 100%. It's only at 90%. But we have less than half of the frontline worker population having their boosters, and we know that increases their chance of getting Omicron. And then when they get it, then they have to isolate. And this is the main concern: is we've already had staff shortages this entire time. Now we're facing something we've never faced before with this level of transmissibility, and there is no plan for what to do when these workers start getting sick en masse, which is exactly what's happening. We have over 2,000 right now sick at home. Well predicted. You all saw, I was screaming about this for a month now and saying, get the N95s in there, get rats. We need, rapid antigen testing of all workers every single day. They were only really rapid testing visitors that were coming in, the caregivers, but they were only testing, staff maybe a couple times a week. And so we're sitting here going, oh my God, we see this, we see it happening. It's going to get very bad very quickly based on what's happening in other countries. And it felt like nobody was listening. It felt like the entire PC party was on Christmas break, the entire month of December. That's what it felt like. I couldn't get any traction with anyone. And then everything, as predicted, came to unfold. And now we're in this mess again, and we are starting to see deaths. It's one thing when the residents aren't dying, but now we've had 10 deaths over the last week. And we're not getting information on whether those are the residents who hadn't received their boosters yet, because there's, almost 8,000 that hadn't received their boosters yet to date, which is a huge problem. And we know that there's a backlog in the cases and in the data. So we're just sitting here.
But wait, they're saying they can have their fourth one. Before they've even given out, how do you go from 2 to 4? Do you not need 3?
I think you all saw how miffed I was about that. Because listen, I have no problem with 4th doses. But my problem is when you're pitching it as this cure-all, when you haven't even finished 3rd doses yet. Can we learn to walk before we run? And this is what it irritates me when I feel like something is done for PR when we're not. There's still a fire going on over here. Can we put that out first before we deal with the burning embers over there? Like, what is happening here?
With your inside information, did Rod Phillips or his team ever explain the comment how an N95 and everyone having one will actually put people at more risk?
No. So, and
I'm blown away by this. Is there anyone watching or the ladies on the panel that it makes sense?
We all saw it. The thing is, what really upset, and I wish I could have been in that interview. I wish I could have been with Jackie Crandall's asking those questions, because, the main question should have been, well, hold on, what are you talking about? Explain yourself. Because his rationale was, you're saying to do the opposite of what the chief medical health officer is saying, which I think everyone roundly criticizes as terrible. And this is why people are asking for his resignation no differently than they asked for Williams' resignation. And may I remind everyone that the flagrant violations of the precautionary principle by Williams, who knew the workers were going to the long-term care homes in the second wave sick. This is all documented and did nothing. So, thousands of deaths. You knew it was happening. You knew they were sick. You admitted it to the commissioners. All of you knew. And you did nothing like offer paid sick days, because that's what we were begging for, so that they didn't go to work sick. Because you put these low-income earning women, many of which are new to Canada, racialized women who are exploited as is. What are they supposed to do? They're just not going to get paid? Well, you put them in a lose-lose situation. And not just that they have to show up for work, but I hear from workers all the time that are like, well, if we don't go to work, who the hell is going to take care of the residents? And they've developed relationships with them, and they don't want to abandon the resident. You literally put them in a lose-lose situation because you didn't want to offer paid sick leave.
Unbelievable. So your energy,
that was what he was trying to say.
Your energy is second. I love it. It's second to none. It's what's needed right now. It's what's needed all the time, because honestly, if we don't have the voice out there ourselves to call out these individuals, they're not hearing us as much as they're hearing you. And that's why we're leaning on you right now. But we're here. We're here to support you. You're not alone in this. You're not on your own. You actually have a bigger fan base that you're willing to support base than you're willing to even admit, which is great, because your humbleness on that end is completely admirable, along with the ferocity at the other end. And I thank you for that. And I'm going to thank you many times. because I don't know how else to say it to you other than your voice is on behalf of everybody, and it's such a great voice. It's an educated, well-spoken, powerful voice, and we can't do this alone, and we're here to help you, and we're willing to give you whatever you need. Now, I'm going to let some of the panel ask the other thing. I know your time is special right now, Dr. Viv, and I know you gave me kind of a window, and I'm going to try and use it as best I can before you go.
I can stay for a bit.
Good. That's fantastic. Is there, for people like us, the common individual that's either dealing with family members in long-term care facilities or that's working there, so families, friends, and staff, is there a whistleblower program out there in the province of Ontario that's
I'm looking
legit?
at the chat, and they're so cute. The people in the chat. Making me laugh. Yes, I do seem pissed, and yes, I am always like this because
I love it.
And I wish. Trust me, because when people know me outside of advocacy, I'm laughing. I love people. I'm friendly as all hell. But this is like serious stuff. I can't not be upset when I hear from hundreds and hundreds and hundreds of family members, and I hear horror story after horror story, and I'm very emotional. I'm a hot-blooded Greek woman, and I'm an empath, and I feel people's pain, and I get very angry at injustice. And I've always been this way since I was a kid. And when I see people, vulnerable people in particular, being just wronged, I get, you can't shut my mouth. You can't. Like, I'm sure they do not love me in the government right now.
Good, but that's why we love you. We don't want them to love us. We need them to work for us.
Yeah, I've never been in this game for friends. I've never cared about. I don't need friends. You know what I mean? Like, for me, it's just not about popularity. I don't give a
Well, there's a reason why I was very flattered and excited that you would join. It's because of this. This is who you are, and this is what we need, and this is what we love. And everyone agrees. I know it. And unfortunately, you end up. I'm going to skip ahead a bit. I had a question for you near the end, but I'm going to ask it now. I read something in your. I'm going to maybe say Chatelaine. I don't think it was. One of your articles that are out there. There's so many, they mix up. But that says that you yourself are actually starting to become, you're hearing so many stories. You're dealing with so much grief and horror story and pain that you yourself suddenly start to struggle a bit. You need to have your own, you need your own coping. What are your coping mechanisms, Dr. Viv?
I'm honest.
What are your
I don't
mechanisms?
care about being honest. That first year, like, keep in mind, so I'm incredibly close with my grandparents. Like, I've always been. My grandpa's my favorite person in the whole world, and my grandma was, and that was, so she died right before the pandemic. So I'm already grieving, and then we go into lockdown, and I'm like, I'm already trying to deal with this. And losing my mind about having lost her in a way that I'll never get over and I'll never forget. And then the pandemic, and then I start talking to families and hearing their pain, and I couldn't sleep. I didn't sleep. I don't care admitting it. I had to go on antidepressants just to sleep because there were ones that help you sleep apparently. And I've never been on like consistent medication my whole life. And I had to. I couldn't sleep. I would just wake up after an hour and I'm thinking about everything these families are telling me. And the grief, and that, like, when you hear people crying to you, how do you not feel that? How do you not take that in? And these families were traumatized. What they went through was like, I've never heard anything like this on the scale I was hearing. I didn't sleep. So for about 8 months, that was my main coping mechanism. And then I finally wanted to wean myself off of it because I don't feel comfortable generally being, and I don't judge anyone else, but I just wanted to get off them. I didn't want it to be something I was on forever. And then,
are you alone though, Dr. Viv? Are you alone in this fight? Like, is it just? Do you have a team? Do you have a panel?
No, I'm alone.
That's why you're not alone, but you are alone. I know what you're saying.
I have the families, but I don't. And it's funny when people reach out to me, like media people, or sometimes like we're podcast people. You know me, but like they'll be like, "Can I talk to your assistant?" I'm like, do people think I have like a team? Like I'm like a nonprofit? Like I'm just one loudmouth Greek woman who just cares a lot and has education in this area and can use those skills to speak about it. But like, I don't have a team. This isn't my job. I have a full-time job. This is like, I'm juggling this as like my side volunteer hustle. Which
I said you were a professor at the beginning. I introduced you as a professor. So on top of all this, you're running this high-end high stress career on top of the work you're doing outside of that. And I think that was important for you to highlight that right now, because people need to see the other side of you, that you're not just this robot going through this, no feelings, no emotions. It's just a fight, fight, fight. Like, you're human as well, and you're alone in this fight, and you're fighting a huge, huge fight. And I know that,
right? Like, I've talked to a lot of these families, and
they
like,
know.
I've cried with a lot of them. Like, they know that and it's the sweetest thing is that the families are the ones that reach out to me, and they'll check in and be like, "Are you okay?" Because I know you feel so much of this, and like one of you guys know Joanne Beggs, who I love, and she's dealing with so much hell right now. But I'll never forget, a few months ago, she even said to me, she goes, "I think, like, I'm worried about you because I feel like you're taking on a lot of vicarious trauma." And I know that, and she knew, I tell people I'm an open book. If you ask me if I'm struggling, I can tell you I'm struggling. And this is what I have to do in the meantime to get through. So, like, and they're the ones that reach out to me and actually check in to see if I'm okay. Right. Like, it's this really sweet community of long-term care families and staffers too. And we've all
I know
bonded.
you know those people, though. I know you know the families do, but I want you to know that more than that is there too. And this is what this pot, I hope it spreads beyond. It doesn't mean that you're using the system right now or that you're struggling with this. It needs to be everybody. We need to collectively get behind you. And that's what I really want to spread the message of today, that the support is there. I don't know what to do sometimes other than reach out and say, can we get your message out there even more? But you're doing that by the hundreds. And I know all of us are trying to say, how can we get Dr. Viv the support she needs to keep being our voice that is actually being heard? They're hearing you. And they're not hearing me. They're not hearing MJ necessarily, or Maureen or Leanne. They're hearing you. And we want to be there to give you whatever you need to help keep this going, but without your struggle.
You're very, very kind to me. You're kinder than I could ever hope for. And honestly, the families are the ones that I do it for.
Yeah.
I was, there's always I was a long-term care family. So I feel what you guys have been through, and I feel such a bond with them.
I'm going to let MJ have a quick word, because I promised them all at least one
please.
word with you, because we finally have.
It's getting super moonlighting here. It's
I don't want you to go just yet. So MJ,
when you start to talk about your feelings, it got darker. I thought it was very dramatic.
I ruined the mood. It got all dark. I'm like, geez,
it's good. It's all, you've got all the energy with you. There's nothing left to light the room now. You've got it all inside. MJ, do you have anything for Dr. V?
I have some, and I may just end up talking into a question, but it's probably more, I think, as I started sort of connecting with people online, and I started to hear the actual horror stories that families were going through, my first thought was, I don't think the majority of Ontarians, let alone Canadians where it's happening elsewhere, have any idea that, unless you have family that are going through that, that this is happening in long-term care homes here. Like, I think if people knew that you're finding bugs here and feces there, and people are left with food in their mouths, choking on it, and that people have been, bed sheets tied through their wheelchairs so they can't move around the floor in what they call the veggie patch. If they knew these things, I can't believe that they would be okay with it. And so the only thing that I have found myself is in frustration through this whole thing. And I guess because I'm the mom of kids and we're going through COVID with school frustration, is the need to make noise. And the only way I seem to have found was online, because we can't really go anywhere easily to protest. Like, it's all planned because of COVID protocols and all that, right? So I find myself just constantly just going, right? And so I'm first, like Brad has said, so grateful that your voice is as big as I think a lot of us feel it needs to be, because we're just wanting to scream for these people. But also because we have, the struggle I see is that we've got these immediate fires like all over the place. But, the fires didn't start with this government, as much as they are really, really at fault for a lot of the crap that's going on now and how it's getting worse. We know it's been ongoing for a long time, exacerbated and highlighted during COVID. And I'm with Maureen that I feel that, like, we have to put these immediate things out, but there's also this other thing that we have to fix, so down the road it doesn't keep going, and in the next pandemic doesn't happen again, that kind of thing. And so the idea behind wanting to really get some federal national standards set so no matter who's in power in your province, no matter who's in power
Right.
at the federal level, that our long-term care system, or even the way we house seniors in their older years, maybe there's a whole revamp of even how we do long-term care, that it's the same and expected. It's always going to be upheld for the dignity of the elders in our communities. And I feel like it's a massive societal paradigm shift that we need, where we are not okay with us aging and being treated like this. So what can we do, and how do we get everyone engaged
Right.
to fight that?
I can't emphasize that enough. The fact that we need. Oh, okay,
I had to
that's
get the lights on.
fantastic.
Yeah, it was really dark.
Yeah.
I had to
So
turn the light on.
Yeah, we have at least 10 more minutes then, ladies, so that we have the light back on. She doesn't have to go yet to go figure out.
Yeah, right.
MJ, I couldn't agree more. We need to support Dr. Viv and her message as much as we can. And that's what we're trying to do. And absolutely, I agree. What you said there was perfect, where we feel what she's saying. She's our voice for the strength and the passion that we all have into this. Leanne, I know you've been waiting for this since, when was our podcast? November?
Yeah.
And I promised you, so have meet Dr. Viv and questions that you may have.
Yeah, probably my biggest worry or fear now that I have parents in their 70s, and now that we have this in our family, and now all of a sudden my family is saying, oh, because they do this, oh, is that you're having fun with this, are you? I'm like, this is not fun. This is an advocacy.
It's not a hobby, right? Yeah.
It's not a hobby. And now my mom is suddenly going, please don't put me there. Please don't. Please. And I'm like, I promise I won't. So anyway, my question is, besides screaming on Twitter, what else is there to do? Like, we have the Ontario Health Coalition, and we've done the things. Like, you guys have gone on and you guys have talked about, what was the thing called? I just had a brain thing.
Bill 37?
That one. And we watched all that, and then that felt like it went nowhere. And so is there even any power left? And why? And maybe, like MJ said, that maybe most people have no idea that this is not a nursing home, that nurses per se don't take care of. PSWs are fantastic. They work hard. What do we always say?
Conditions of
work become the conditions of care. Pat Armstrong, she's brilliant.
Yeah.
So if we can't move that needle and we can't push, what are we to do?
Yeah, honestly, at this point, my best suggestion to families is just contact some lawyers. I don't know how else. You try to appeal through reason. You try to appeal through the general, this is wrong. Well, please use your power, people in charge, to fix this now. Because if you're not going to fix it now, after the worst long-term care humanitarian crisis in our entire existence, when are you going to do it? You're never going to do it. So we're trying to strike while the iron is hot, so to speak, but we can't seem to get through. And that's why, we had created a separate Canadians for Long-Term Care volunteer advocacy group to try to push Trudeau, our prime minister, to do national standards, because you get to the point where you're like, well, if you have a provincial government that is not going to budge and is not going to listen to the experts and the clear evidence in this area for how to progress to a better system, we have to try to go above, right? And that has been equally frustrating, because we thought we had some momentum for a bit there, and the prime minister himself had floated the idea of criminal charges and national standards. So we struck, and we started asking for meetings, and we got those meetings, and it just so far has gone nowhere. And we're just like, how you just sit there and you're like, how is this happening? How is this like the worst thing that has ever happened to older adults and persons with disabilities in congregate care, bar none, during COVID, the mass casualties, and yet nothing has actually improved.
Nothing.
Yeah, I agree.
It's mind-blowing to see just how captured this whole industry is, and how really you follow the money. And I hear a lot of my tweeters say that, follow the money, look at the conflicts of interest.
It's deep.
I don't know how else to explain the lack of change in this sector, other than there are very powerful people who don't want it changed. Because
And
it's
unfortunately,
very
we live
profitable.
in Ontario, we live from election to election. So right now we're sitting there going, well, there might be change, but it's going to be in June, maybe. And now we're going to wait till June, but June's going to be too late. And by the time they get in, and even if there was a new government formed in June, they're going to be another year getting their stuff. It's never ends. This just keeps going. No one will address it today. And I can't believe there are no standards or enforcements. That's the enforcements.
I know.
Any of us who have a job have somebody that's enforcing us and making sure that our job is done properly. And then you get to this
Bill
high level.
37 protected them even more so.
Oh, very
The passing of that and the fastest push through I've ever seen that government do anything at that speed. So undemocratic. And all it did was improve the chance that for-profit will be protected. Right. It also made sure that, the wording was such that they didn't have to follow through, because the wordings, the verbiage they used, and it really wasn't something people could hold them accountable for later, all that kind of thing. And it's that kind of stuff that I think deflates people's balloons. But then, like we all sort of take a breath, or someone like Dr. Viv gets on again, or another advocate gets on again, and we go, okay, like you still got to fight, because there's still your family. There's still lots, Brad, as you know, in your line of work, there are a lot of people in those homes who have no one fighting for them. Like those no family member, nobody, right? And we just have to kind of keep it going.
Now, Maureen, did you have, I think Dr. Viv's there.
I'm here, yeah.
Yeah, there you are.
What happened there?
Rookie might put you, but I guess MJ just wanted the top center, I guess. There you go.
Yeah, I know. You can put me anywhere.
And Maureen, you're coming up for a question here. So now you're right beside Dr. Viv on the screen. And feel free, Maureen, to ask or chat.
I chat with Dr. Vivian quite a bit. So I just want to sort of piggyback on the conversation that was started. And let's just go right to the person that can make these changes, and that's Rod Phillips. And I was watching that press conference, and I was so disappointed that media came on there and started asking questions about the money that Ford's offering for small businesses. Like, hello, we are discussing long-term care here. And then on top of that, to hear Rod Phillips say that, like, I listened to the entire thing, and not at any point did Andrea or anybody imply that they were doing anything unsafe for long-term care. So
the opposite.
I'm gonna just
protect the workers and the residents. That's all we care about.
Now,
Dr.
Viv.
It's not like he hasn't been accused of that in the past, but what I want to sort of go backwards a little bit, where we first met Rod Phillips, and when he came onto the scene and he took over from our good friend Mary Fullerton, and he held a meeting with us, and he looked us in the face on Zoom and told us all of these things that were going to be different now that he was in this posting. And we have to admit, Dr. Vivian was there. Like, we walked away with a lot more hope than we had with the previous minister. But from a caregiver's lens, we needed that, because we've been on the inside. We see how horrible it is. And I'm a photographer, and if I could go in there and break every rule and take tons of pictures, I think we could make changes, like to actually see and live what's going on in there, no matter how hard they try. And it's not the staff's fault, and then for him to turn around and say something like that, I feel like he's just falling more and more and more off of our team, which he was presented himself that he was a part of, and that he even said he would have somebody in his office that would be a point of contact for caregivers, and caregivers would be recognized and valued for what they do. And now these long-term care homes, some of them are making up their own minds, deciding to keep caregivers out, even though it's a directive that we fought damn hard for and screamed a lot. I know Dr. Vivian was pretty hoarse about letting
that's why I started my
families
advocacy.
in.
That's what I was pushing
Exactly.
for initially. That was my main thing, was let them in.
You know,
Can't
and
do
if we had a minister that was, here's the rule, you don't slide on it. But you know, these homes are just taking it upon themselves to shut families out again, and we can't go back to that, man. I mean, how many months? 4 months I lost of my mom's last year of her life. You know, being locked out at Christmas. When you live something like that, it's the same
Yeah.
thing Vivian said. Like, you can't sit still and you can't keep quiet.
Yeah.
But
Now-
the fact that the minister is allowing this to happen and the government is allowing this to happen, and then we see them giving more and more money to them and extensions of licenses and stuff, give me a break.
I agree.
You know?
These changes are time sensitive too. We don't have years to now implement
Exactly.
another. Now, that being said, Dr. Viv, or anybody out there, is there a country, a nation, a province, a state, whatever, out there that has what we would call a better setup for long-term care, a more admirable model to follow, so that we don't have to reinvent the wheel? We're not trying to invent anything. Like, can we just adapt standards that are out there somewhere else?
Yeah, I mean, you know, you look at the Nordic countries, Denmark is a key example, right? So like they stopped building institutional facilities proper, and they moved to, like, you know, first of all, the most important part is that 90% is publicly administered, so it's like public healthcare. And then around 30 years ago, they said, we're not going to build any of these big institutions. So they started building like smaller houses. So like you'd have like, you know, long-term care houses of like 8 to 10 people, right? And it felt like a home, and they're like one floor, everyone has access to the outdoors, not like these big warehouses now where, you know, many people are on the 3rd, 4th, 5th floor, you can't even open a window. Like, it's horrifying, right? Like, everyone has their own little backyard you can access, you know, and even we learned, you know, all the families know this. If any of the long-term care residents right now had like a 1st floor, it was like prime real estate during COVID, because you could actually walk up and see your loved one. Like, everyone else was completely screwed over, that their loved ones were on like the 2nd or 3rd floor. People were taking like cars, backing it up and getting ladders and building, like trying to climb the walls so they could see their loved ones. I mean, this is how terrible it was. So when you realize how you know, it could be done differently. And I've said this, I have many times, I have gone over Nordic models, the fact that it must be public, the fact that you can move to more home care style models, but it has to be publicly available and provided by well-paid healthcare workers that are regulated and monitored and more akin to like what we see in hospitals. I mean, it's still getting, you know, degraded here, our hospital care, but I mean, we could do it better. And there's so many more funding streams we could do too to get more money. Like, I mean, Japan has long-term care insurance. We could do that. We should be having, you know, we could have that separate to our existing, you know, Canada pension plan. We can have a long-term care insurance plan. And then everyone has that money when they need it to do as they see fit. And they have the options, right? Like, so people say, oh, we don't have the money for this, we have to rely on for-profit. Bullshit, you do. You do not have to. There are ways you could do it. We have examples from other countries, but for some reason, nobody has the political courage to do the right thing and to think outside the box. They just hope that maybe the next government will figure it out, or they don't have to do it. They can pass the hot potato, as they have been doing for decades, and they're all cowards when it comes down to it. And I don't care who, I say this to every single one of them. I will come for every single one of them that sits there when they have the power and does nothing with it except reproduces the status quo, if not making it worse and aggravating it. And that's what I'm seeing now. And it gets me very upset for everyone right now that has power in elected office and isn't using it, is instead of sitting on their hands. You can't see me right now, but I'm sitting on my hands. And that's what really bothers me. If I had the power, I would have already burned the system to the ground and been halfway done rebuilding it. But
and your power's climbing. Your power's climbing, and we are there. We're only another voice, but every voice we can put out there. And what I vowed to the group here and to the OHC and to yourself is, if at the very least, I'm going to continue this discussion on a regular basis until at least this election. We need to keep this updated. We need to keep everybody informed. We need to get the ball rolling, and I will offer whatever I can offer to support you, Dr. Viv. It's out there. Some of us don't know how, what to do. I know we can support your voice, but we're more than grateful for your time, your expertise and your strength. The need for it has risen exponentially in this last year, like exponentially out of control. And if you put a shout out, I know people will be there to help, and whatever you need. I think that's what we're kind of looking for at times is, if you need a hand, if you're feeling overwhelmed, please just let us figure it out. Yeah. And I think that is the message. And it's if we could be as powerful as you and have the voice you've established, we would.
You all are. are.
You're
all part of my voice. Trust me.
Your time is so precious right now, and it just shows the need for it. You're in such demand. Like, I've been hearing you're doing multiple interviews a day, a week. Like, it's unbelievable that, okay, well then let's get Dr. Viv some support and let's figure this out. We're here to listen. I know it won't be solved today. I know we're super grateful for you joining us. I know the panel watching, anybody who listens to this podcast after, we're all very, very appreciative, thankful, and grateful for having you here doing this for us and with us and for the families. So thank you.
Thank you. It's my pleasure.
I know I speak on behalf of the ladies that are on the screen and behalf of everybody listening right now. I know your time is precious, and if I would honestly, we could do a 6-hour podcast right now and not even get through.
I know. An hour flew by.
So, and I don't want to scare you away from coming back. I hope one day we can chat again, and I'm getting messages from the viewers thanking me, but it's thanking you. I'm just a voice. I'm just a message to bring your voice forward. And I'm going to continue talking just for a bit here with the ladies. Once you go, probably.
You beautiful ladies.
Yes. Thank you so much,
Brad. Thank you.
Thank you. I look forward to one day perhaps meeting you. I'm not that far from you.
I want to meet all these families. We all talk about this. We all want to meet. We want to have a huge party when this is all done, and we can, like, at a big hall of all the long-term care families.
Yeah.
We all talk about this.
It's going to be so much
itching to meet.
Yeah. I hope this little bit can help. It's all we can do is a little step along the way. And you as our voice, as our leader in this is just, I wouldn't ask for anybody else. So thank you. And we look forward to see you. Get some rest. Get some rest. I don't know how. I'm sure you have a lecture to prepare for or something, but I mean, just please keep up the fight and let us know however you can do that if we can help at all. Okay,
thanks,
Doctor.
Thank you very much, everyone.
All right, have a good evening. Thank you. So that, everybody, that was Dr. Viv.
Yeah.
Unbelievable.
Can I just make a comment, because I'm seeing some people here that I just appreciate so much. And Christine Cooper, she is the leader of Resistors.
There's a comment there. Such an awesome group.
And Lainey and Pete Massey, I don't know you, but thank you so much for all the comments. And there was another one too that was a PSW.
There's been a whole bunch, actually. It's quite a busy comment section. Here's one here from Rachel that said that she loved her and thanks to me. But honestly, I've always said this. I'm just a messenger here, and it was a privilege to be able to have Dr. Viv on, to be honest with you.
Yes.
And just as much of a privilege to have you ladies on, because we still have some things to discuss. We still have some issues to bring up. And I think most importantly, we had a conversation Friday. So for whenever this is listened to, it was a few days ago now, to prepare for this podcast. And I explained at that time that my drive comes from what I've seen, from what I've had to encounter in my world as a paramedic. And honestly, if you think about it, a lot of our, I hate to call it this, but this is how they teach it. It's a lot of our customers, a lot of our business, our patients are in long-term care facilities because it's just the nature of they need us more. The atrocities that I've seen, and I'm not afraid to get this out there. And I know MJ and Leanne and Maureen, you're asking to bring some ideas forward, some thoughts forward. What I'm going to bring forward is I have on more than one occasion witnessed the movement of patients from long-term care facilities to hospitals with an ambulance, with an emergency vehicle, a fully staffed paramedic crew, to the hospital for a simple staffing problem. And a lot of people don't understand that. So quite often there'll be a floor or a group of patients in a long-term care facility that either have dementia or some sort of memory, cognitive dysfunction. And generally, they will be prone to not having much family or much support around. So these are kind of the loner ones with dementia. And then they are often easier to ship out, and that's the only term I can use, to a hospital with an ambulance because, and what it comes down to, and I'm not afraid to say this, I'm not going to name names, is the staffing issues are so poor in those facilities that they need to offload one of their floor members for the day. And when I ask in person, why am I taking Mrs. Doe or Mrs. Smith or Mrs. whoever or Mr. whoever? My answer is they're just not themselves. Well, here you have a person with Alzheimer's, dementia, whatever it may be, who can't speak on their own behalf. I have no actual cause or just no finding, but it's the law that if I'm requested to take them, that I take them. And I know this goes on. And there's games like this that go on in our long-term care facilities all the time. And it's absolutely atrocious. And it's one of the things that infuriates me most. Not only because of what we're doing to those individuals, they're not patients. I can't call them patients. They're residents. Because they truly don't need anything most of the time. And they're occupying, and the system is now occupying an emergency vehicle and pulling it out of service. So it's one less vehicle available during that time. Anyway, that's my rant. I have I have an agenda behind this as far as what I've seen over the years. This isn't just benign to me. I'm not just bringing you on to have your say. I have a vested interest for sure. And I know that you've been at your rallies. You've shown me pictures of rallies, and you've shown me pictures of the group of you working together. And I want to support that as we are now. And that's what I promised you in our pre-show chat, was we're going to do this regularly. I don't know if it's every 4 weeks, every 6 weeks, every whatever, to try and keep up to date, especially prior to this to this election that's coming up in Ontario in June. We're going to keep the momentum rolling. We can't let this message get dropped. So thank you all for what you do. I don't know, the floor is open. If you have anything you'd like to add, absolutely. I'm going to look at some of the questions. I'm going to see if anybody, some of the questions were for Dr. Viv, who's now gone. Rachel put, I love these ladies. And I put a heart behind it. Does everybody know Rachel? I have no idea who Rachel is, but she loves you. And I love it that the acknowledgement is there. I want you to all keep fighting your fight, obviously. Don't let off the gas, and you don't need me to tell you that. And I encourage everybody out there to follow what they have, what these ladies have on the screen is their actual social Twitter handles. And you're okay with people reaching out, correct?
Mm-hmm.
Yeah,
and
100%.
MJ, you have
tweet. Oh, sorry.
Yeah, go ahead. No, go ahead, Marie.
I sent out a tweet a few days ago, just, saying we absolutely need to have, it's time for like a huge uprising. And I don't mean just those people that rant on Twitter every day. I mean, like the citizens of Ontario. And really, that's what I'm saying. Like, if we can highlight the exposure of what truly happens inside of these homes and how horrible, and the whole for-profits, I don't have to go into it again because we know how horrible it is, but we have to get behind it, make sure we vote these people out, number one, but that we just keep it relevant, keep the stories relevant, because once the numbers start going down from the Omicron, then the stories will not be as frequent, and then it'll just slide in again. Like when we went into long-term care, it was pre-COVID, and it was gross and it was disgusting. And I was appalled that I had to even leave my mom there. And then COVID happened, the whole for-profits. But there's only so many of us that are making noise, which I love MJ for, because she's making some noise.
Yeah. For those of you that don't know, MJ,
I mean, it's like rolling protests in front of Rod Phillips' office, rolling protests in front of homes that are keeping families out. I don't mind showing up there. In fact, you can see my Twitter handle. DM me if you're a family that's being kept out and an essential caregiver that's being kept out of long-term care. Give us a call, because there's just no way we can continue putting up with this. Like it's so detrimental. Like I said, for those inside, and then MJ, whose parents are on a waiting list. Yeah. How would that's like just going down the darkest hole you could imagine. And it's like, oh, well.
It's a horrible thing that time doesn't allow. There's too many topics for one discussion. There's too many topics for a month-long discussion. And it's simply disgusting anymore that it's come to that. I will say COVID is probably one of the most horrific things that we're all dealing with right now, from whatever level you take it, from whatever view you have, whatever stance you take. but it has, and I tried to say this earlier, I'll say this delicately, it has had a plus for me in that it's opened the doors to these long-term care problems. It's unfortunate those doors need to be open. It's terrible, but COVID brought in the military, that brought in the scathing report to Ford. And yes, you did nothing about it.
Nothing.
But it opened more. And then we've gathered Dr. Viv. And now we have a panel of you powerful ladies and other members who are not even on the screen that join your cause. And it's slowly rolling. And for that, I couldn't have asked for a bigger voice for these concerns. And I know out there, this comment was up earlier from one of the viewers named Pete. He says, I know all of these champs on Twitter. So not only are you Twitter members, you're actually champs. And I agree. You all have very, very knowledgeable backgrounds. You don't speak gibberish. You're not just whining. You're not just there's always a strong message to be had. And MJ, you often have your Make Your Noise campaign, make some noise. And this is one for anybody that doesn't follow MJ right now in the social media, where MJ, you put out the numbers of certain political individuals. It could be usually our premier and our Rod Phillips office and whoever else. And you say, call, make some noise, and you try and trigger everybody. And I think that's great, because I know when I've called and then we message each other on Twitter, and then you see how many other people are doing, and at least it's a voice. And I really don't know right now, because those politicians have our hands so tied, but they can't tie our voice. And that's how we start.
Truthfully, Brad, thank you for that. I absolutely, when this started, like I said, I was just everybody was really just losing their marbles because they just couldn't make change because you couldn't go anywhere. And I think ended up just feeling like that was a place where I could start saying, okay, you know what? I'm going to start calling. The initial thing for me was the horror stories of long-term care. And then sort of simultaneously was my youngest ended up being in an age group when it came to vaccines for the kids between 12 and 17. And she was in a limbo kind of a group of months where she was turning, 12 by the end of the year. And that left her in a really vulnerable position. I had followed as much of the research about the vaccine as I could. I felt, and along with my husband, that it was a reasonable, risk take, whatever your take is on a vaccine. My point being that it was through a ton of fellow parents out there where we started using hashtags like kids in vax limbo. And we called the premier's office, and we called Christine Elliott's office, and we called and texted and emailed and for, it was months. I think I started in May, and I ended up taking my daughter to a public health unit out in Sarnia. So, 3-hour drive there and back to get her first dose. And by the time it got for her second, Doug Ford, they realized they stopped public health units from doing it. And then 2 days later, because we went on a rampage, and when you go on these rampages, what I know sounds so rampage, but media picks up on it. And enough that maybe that's how our voices get to the politicians, because whether we like it or not, the current government really hates noise.
Who else picked up on it? Was Rachel's grade 5 son's class. Do you see the comment?
I love
The
that.
whole class called, and I think that is so amazing.
Class called?
So fantastic. I think you know what, that's that just shows your message is out there.
Yeah, so by the time school started, my daughter was vaxxed with her second one locally. 2 weeks later, school started. So I felt like, because with long-term care, with anything, not one decision we've made for our family members during COVID has ever felt 100% right.
No.
Right?
Nothing. No.
Right? You're always like, should I?
You just hope.
Whatever.
You just hope.
Right. So I guess I feel those days where we feel hopeless, right? We see people online saying often, today's a rough day. I really can't do it today. Can't fight today. And you're like, you know what? We're all having those.
Yeah.
But I do see we're making impacts in little fits and starts. And so I guess because right now this is all I can do to offer, some advocacy, I'll continue to do that. And honestly, I love all of you guys out there who do share my messages.
Yeah,
You kind of like, you appease me and you amplify whenever I ask. And I'm so grateful that you do it out there. You're awesome. And you always add your own little like in there. And, but changes will happen. It's painful with long-term care. I think that's a thing, is you've got all these fantastic people like yourself, Brad, who've worked for 20 years, 30 years in these places, and they haven't seen any change.
Yeah.
But like you said, Brad, it is exacerbated through COVID. It's way out there now. And I think along with your desire to maybe have these podcasts kind of continue at least up until June to see what impact we can make to get governments in there that potentially will do more for long-term care. It's actually completely in line with something that Lainey, who I hope is watching, I don't know if she is, but she's another advocate, Lainey Tessier, and she and I are working with Natalie from the Ontario Health Coalition, who, by the way, is one of the fiercest voices out there. Sweetest individual. If you ever get her on here, Brad, you'll have yourself.
That's who I'm going to allude to as we get closing in here.
Okay, good. Because she is the sweetest person, but you get her speaking in front of a microphone and she will blast you with the data, with the facts, the data, her experience and what she's seen and what needs to happen and why it's not happening. And so with her guidance, Lainey and I are working on a social media blitz between now and June to keep the long-term care issue in front of people's, in the forefront of people's minds so that we don't forget. Right by the time we get there. And so I love that maybe your things might jive with this.
And that's what I can offer, and that's what I said. I've been privileged. This podcast network approached me, we talked about it. I agreed to bring a podcast forward, but all I am is a messenger, a way to get that voice out, and I'm happy to support that way, and I'm happy to bring my side of the story. I can tell you right now, pre-COVID, if I had done a long-term care podcast, are you nuts? What are you talking? And so you're absolutely right. It's opened those doors that were unfortunately needed to be open. And you alluded to the Ontario Health Coalition. And I know that when Leanne and I chatted initially, that's something that she joined in, and viewers at home who may be interested
through Twitter.
Who want to reach out and find out more, I recommend that you follow. I don't actually have the Ontario. Let me just double check here that I don't have the Ontario Health Care. It's just Ontario Health Coalition. And they have a Twitter handle. And what we can do is say, if you're wanting to reach out, Leanne, explain your involvement with them, or what happened with your story.
Just Twitter. Just one day I found Maureen first. I think you were my very, very first, like, ooh, what's this? And then I just sort of through there, she put out something that had said, anybody that's interested and wants to help, please contact. So we did a DM and then we just joined. And
Excellent.
We go on meetings usually once a month and through Zoom, and we do what we can.
I've been asked by some viewers in the chat comments here to put up your socials at the end, and I will also include the socials for the Ontario Health Coalition. So there it is there. It's at Ontario Health C. Ontario and Health have a capital. I'll get it up on my socials later after the show as kind of a note to follow. Oh, there it is.
Put it up.
I'm going to put it up right now because Christine's typing for. I'm trying to do too many things. Christine, thank you. Helping me out. There it is there. At Ontario Health C. Yeah. And there's another option for all of us to kind of figure out if you're looking to help more, you want to see what's going on. And it's not just long-term care. Ontario Health Coalition has all the branches of our health system in the province. So if there's something else that actually triggers your interest even more, or along with long-term care, I encourage you to reach out. But that being said, we've been almost an hour and 15, ladies, in a quick chat.
We did good.
I hope you were able to convey some of the message that you want. If there's more that you want to say, absolutely have at her. I think we're going to come back with another show. That's a given.
Do you
Your
mind
name's
if I
right there.
say one more thing?
Not at all. Do you want the whole screen? I can try and get music. I've never done this.
When you do the whole screen, it just makes me see myself really big. I don't need that.
Yeah.
So
okay. That's what everybody sees too. So
yeah.
We'll leave you alone then. We won't even put background music, but
Oh no,
Yeah.
do the
I need the mood lighting like Dr. Viv had.
Yeah, you just shut your lights
all I'm
right
gonna
off.
say is,
Yeah.
if
Go ahead.
we have a captive audience out there still, I don't know if they're still with us, but
Yeah, I still
and
show a bunch of
I
viewers.
think
Yeah.
we've been doing it. I think it totally ties with Dr. Viv. It totally ties. I think Maureen, you'll like when we're thinking about where we're going to be in however many years. And Brad, you talked about the aging population, and Leanne, we've talked a bit about people with dementia, and how many more people with dementia are going to be out there where we need people properly trained to deal with those people as well. All that kind of stuff. It's when we talk about, even we can't believe that people in Ontario or Canada, what they would think if they really knew what was going on. I think as much as we can with your family members, start talking about it if you're not already. Even if they think it's a hobby, Leanne, start talking about, hey, like,
it's not
this
a hobby
impacts
anymore.
you. You may be 40, you may be 50, you may be 60, but when you get up there, look at, you're only one accident away from potentially being in there when you didn't plan it. I can tell you, my parents did not plan to be in the situation they're in. We didn't see any of it coming, nor all the challenges coming along. And you get some people who will say, oh, it's up to the family to keep them home. I would never send my family member to long-term care. You must know that I could guess almost no family wants their family member in long-term care if they knew that they could do something for them.
And I can vouch for that, MJ. In my job, I show up to people's houses that morning they were fine, and now they're no longer independent for whether a medical condition or a trauma or something. And it can happen in the blink of an eye. It's something that needs to be brought. Yeah, that's right. It needs to be enlightened.
Look, it matters to you whether you think it matters to you or not, right? And so, do you want to live here? No, then get on the horn, or cast your votes accordingly, or with our best chance for someone who's going to make a difference. Something, right?
That's right.
So just keep talking, at least even off our social media.
Yeah.
Kind of thing. Because there are a lot of people not on social media who don't know this stuff, right?
I want you to know that there's I put up a comment there earlier by Army Chris, and he's on the podcast network. And this is like a hardened veteran that was a guest of mine on a pod a few weeks ago, and he's watching. So that demographic, and he's paying attention. And if Army Chris is there, and then I've just put up this from Andrew Visser, a fellow, he's on my shift. He's a fireman at home. He's watching this with his family. And it's not just that everybody thinks there's a certain stigma with long-term care and their supporters and what they look like and who they are and that, but it's much broader than that. It's everybody. This long-term care issue affects absolutely everyone. And if you think you're immune, it could be a rude awakening one day. And I hope that you don't have to find out that way.
Yeah.
So I want to thank you ladies a lot. And I want to invite you back. And I want to tell you to keep your heads up. Sometimes I know these fights feel like you cannot win the fight ever, but you're making ground. It's a slow battle, especially with these politicians that we're facing all the time.
Do you know?
There's a comment here I'm going to bring up here. I'm going to kind of close out with this before I give you any kind of last say that you want, but it's Lainey says, you women and Dr. V are so great. And the amount of time and labor you invest in this is admirable. And I couldn't agree more. And I think that's a great...
Lainey's fantastic. Yeah. I met her, it's almost 2 years ago now, I think. And she was on a thing with us way back. And
excellent.
She's resurfaced. There's some just incredible people out there on Twitter. So just...
This guy here, Greg Sullivan. Thanks for all the great work. That's to everybody out there. And I know that's another fight. He retired off my shift. Not even, I think we're at a year mark now, almost. And I love that guy. I look up to him, and he's listening. They're listening. You're starting to get your message out, ladies.
Good.
And to a lot more people than you may realize. So I hope that you continue on. And I look forward to following more. I hope we don't need to meet you ever again. That means it's done and we can go and meet about, I should preface that with other things. Yes.
Other things.
But I hope that you have a better week, and I hope you enjoyed talking to Dr. V.
Absolutely.
Awesome.
And
I just listened to her.
Yeah.
She is a powerful voice and a determined and fiery individual, and it's amazing to see. I'm going to close out now. I'm going to just kind of say my thanks here on the screen, and thanks to all my viewers. It's actually been a very successful live podcast. We've had quite a few comments going. There's some chatter amongst the comments that that weren't brought up to the screen. I've had Rook in the background there help me out, and it's been a great addition to the podcast. But thank you so much, Leanne. I'm going to zoom you out. We'll chat in a minute. And Maureen, thank you. And last but certainly not least, MJ. I just want to thank everybody for watching today. The topic is heavy. It's lengthy. It's overwhelming. But if we just kind of take it one bit at a time, one piece at a time, we can slowly make some progress against this government that's been opposing us for so long, fighting us and going against every kind of common sense issue, thought process that we have. The fact that somebody would in our office would say that N95s are actually going to put them at more workers at more risk of catching the virus just blows me away. I just can't. For those of you who missed or did join in with Dr. V, I really, really encourage you to follow her on Twitter. This is actually a screenshot of her Twitter. And I've learned that one of my guests today, Maureen, took that picture. And it's a fantastic picture. Maureen is also a photographer, and she has an Instagram page. And everybody that's kind of curious as to her work, I would encourage you to follow along at McD Photography on Instagram. I want to thank everyone for tuning in. I want to thank Dean Blundell and his network for supporting me and giving me this voice and this platform. And Rookie in the background, if you're still there, thank you for all your help today with the pod. It was great. This podcast, once we're done live, will be streamed up onto the socials and onto the various platforms. You can listen to it on YouTube again if you want to hear it again. If anyone's looking, you can watch it actually, on YouTube. The audio versions will be available on Apple Podcasts and Spotify, and you can also link in through deanblundell.com. I have my socials, Offload Delay for Instagram, Twitter, and YouTube channel, and a much, much lesser used Facebook account that I wouldn't recommend going through that, but if you do reach out, I may find it eventually. And also for anyone out there, I work closely with I've Got Your Back 911.com. This is more for our first responder side. They offer services for all of us suffering mental health and suicide prevention. All these, it's a network of resources as well as a store. And I encourage, it's a store, online store that has amazing merchandise available to the public and to everybody out there. And the money goes right back into supporting mental health for first responders. And I want to thank them for working along and providing the service that they do. That's it for today. Bit of a longer one, but a highly productive podcast. Thank you to everyone who's joined in. We will get this streamed on the social soon, and we'll be back shortly with a new podcast. Again, stay safe and look out for those seniors.